Welcome, everyone. This is Dr. Clark in the Center for Weight Loss and Success. And today on Losing Weight USA, we're going to talk a little bit about some medical problems that tend to make weight loss difficult. And there's actually quite a few of them. They often have to do with kind of hormonal abnormalities, but then also medications and that kind of thing. We'll hit kind of the high points of all these things. All right, welcome to Losing Weight USA, real-time answers to your weight loss questions, some of the latest updates and research, as well as a little bit of expert advice. Gives you direct access not only to me, but you should be receiving the health tips and recipes via the membership portal. And I encourage you to get into the membership site and make sure you're keeping up with all these things, going through all the different webinars in there, kind of the access to all the fitness things, nutritional things, behavior modification. They're all in there. You should be receiving the health tips and recipes via the membership portal as well. Each of these webinars will last about 30 minutes or so. If you have questions, just type them into the chat box as we go along. We'll get to them at the end. If you think things once we're all done, just give us a yell here at the Center for Weight Loss Success. The email is success@cfwls.com. Phone number 757-873-1880. All right, so again, we're going to talk about some common medical problems that kind of impact weight loss, make it hard to lose weight. All right, we'll get these slides switched over. There we go. All right. So the effects of hormones are wide. We kind of hit on this just about every single webinar, talking about different hormones and how they affect us and how they affect weight. Okay, either too much or too little can produce significant medical problems. And so sometimes getting these hormonal changes, getting these different things in control is going to be very helpful for overall health, but also weight loss included that. And what we find is that there are many common medical problems that are associated with hormones, and they will influence your weight. All right. Well, can't get them to go here. Here we go. All right, so what are some of these common medical problems that affect weight loss? Okay, we hit on a lot of these kind of during a lot of our different webinars, but we're going to put it all together in one quick one here. So insulin resistance, it's something I talk about all the time, really kind of the first starting point there, or the continuum actually starts with carbohydrate sensitivity, which tends to lead to insulin resistance. Insulin resistance is incredibly common and subsequently can lead to diabetes. That's kind of a continuum there from kind of carbohydrate sensitivity to diabetes type 2. They all have to do with kind of insulin resistance there, but they do affect weight tremendously. Then there are kind of a whole different kind of hormonal changes, are adrenal disorders. Your adrenal glands are kind of what kind of monitor us, and they help us get through stressful situations. Now, other things that tend to be more of kind of life changes, puberty, pregnancy, menopause, and depression's another one that affects weight tremendously. Thyroid problems, hypothyroidism specifically, and there's the very common polycystic ovarian syndrome, and finally sleep apnea. All these things are very common medical problems, and they do affect weight tremendously. If you've got a number of them ongoing at the same time, it makes it near impossible. Well, maybe not impossible, but very, very difficult to lose weight, keep weight under control. All right, so we're going to talk about insulin resistance first. Again, it's a continuum. Starts out with carbohydrate sensitivity. Carbohydrate sensitivity means that you just don't tolerate carbohydrates as well. You tend to get great big blood sugar swings. Great big blood sugar swings eventually lead to insulin resistance. Insulin resistance means it just takes a lot more insulin to keep blood sugars normal, but the blood sugars are still at least, staying normal. So often this diagnosis, even though it's so common, this diagnosis often isn't made because people get their blood sugars checked, which say, oh, your blood sugar is pretty good. It's not too bad at all. Maybe drifting up a little bit, but nothing out of the ordinary or out of the normal ranges. But unfortunately, maybe taking on a heck of a lot of insulin to actually keep those blood sugars where they belong, which then subsequently can lead to diabetes. All right, we're going to hit insulin resistance first. So insulin resistance then is the inability to use the circulating insulin in your bloodstream effectively. And this leads to a higher circulating insulin. And you've probably heard me say over and over again that insulin is one of the major weight gain hormones. Insulin turns on fat storage. It helps control your blood sugars. So insulin is a hormone you can't live without. Having zero is really bad. Okay? But insulin also tends to cause problems. So yes, we need insulin to survive, but a too high insulin makes it a lot of other medical problems much worse, weight just being one of those. So this inability of the circulating insulin to keep blood sugars under control leads to higher circulating insulin levels. Insulin, again, is the primary regulator of fat storage. So insulin turns on fat storage. If fat storage is turned on, subsequently your body's going to try to store fat, even if you're eating low calorie. It wouldn't matter. So insulin's turned on, insulin is high, you're going to try to store fat, which makes weight loss hard. Okay? So insulin then impedes weight loss by telling your body to store fat. And potentially, this can lead to diet. Eventually, the high insulin levels, they can't keep your blood sugars normal. Eventually, the blood sugars start trending up, and this leads to diabetes type 2 specifically. So diabetes is the next step. Now, there are two types of diabetes. There's type 1 and type 2. Type 2 is the much more common one. Type 1 is where you don't produce any insulin. Again, that's bad. Actually, if you don't produce any insulin and it's not diagnosed, you eventually get blood sugars 400, 500, 600, subsequently leads to all kinds of medical problems. But it's also when you have no insulin, your body physically cannot store fat, and therefore it's a wasting disease. Your body will kind of just, keep losing weight. And one of the number one ways that type 1 diabetes is diagnosed or begin thinking about it is because people all of a sudden start losing weight without trying. They're losing weight like crazy, and subsequently then they can't keep their weight up. Is because diabetes type 1 would be a wasting disease. It's basically a death sentence without there being prescribed insulin. So again, our bodies require the insulin. All right, back to type 2. Diabetes type 2 is the much more common type. It's about 85 or 90% of all the diabetics that are diagnosed in the world now typically are type 2 diabetics. Much rarer to have type 1 diabetic. Type 2 diabetes means that, okay, you make lots and lots of insulin. You just don't utilize it well. And it's basically the end result of many years of insulin resistance. So eventually, with lots and lots of years of insulin resistance, insulin levels being really high, eventually your body can't keep the blood sugars under control. Blood sugars start drifting up, so you can no longer control the blood sugar, but you can store fat really, really easily. And weight gain then just goes up very, very quickly, very easily, and it makes it incredibly difficult to lose weight. All right, so diabetes type 2 is kind of that continuum from carbohydrate sensitivity, insulin resistance, to diabetes type 2. Again, very different disease process than diabetes type 1, where you don't make any insulin. So as a matter of fact, they're different enough disease processes. They really should be called two different things. It kind of makes it confusing that they both have high blood sugars. That's really the commonality there, but that's really about it. There's not a whole lot of other commonality. Okay, so blood sugar disorders, insulin, that's the most common one that we see that makes it really hard to lose weight. Okay, but other things, adrenal disorders, your adrenal glands sit right on top of your kidneys, and they're little small glandular things, and they release your stress hormones, cortisol being one of them. Now, they also release the acute stress hormones, adrenaline or noradrenaline, sometimes called epinephrine, norepinephrine. Okay, same names, okay, or different names for the same things. Okay, but they release your adrenal glands release the stress hormones. Now, cortisol though is the chronic stress hormone. Adrenaline, noradrenaline, those are the acute stress hormones. The chronic stress hormone again is cortisol. All right, cortisol typically makes it very difficult to lose weight. And part of that is because cortisol stimulates weight gain, especially in the abdominal area, in the truncal area, so along the back and on the face too. So people typically with true adrenal disorders, which are fairly rare, okay, is that they may get what's called a moon facies. Maybe they get this round face. It's because they actually store fat in the face. That's very common. And then in the truncal area, they get kind of round body. Okay. Other things cause that as well, but adrenal disorders can. Okay. So these high cortisol levels can also cause insulin resistance, so we're back to that first thing we talked about, but also tends to cause high blood pressure, increased cholesterol, increased triglycerides. All these things make health deterioration easier. Okay, so it is important. How do we control cortisol levels? And cortisol again is our chronic stress hormone. So kind of, anti-stress management. Okay, whether it be deep breathing, yoga, exercise, lots of different ways to help control this a little bit better. But chronic stress tends to have chronically high cortisol levels. And it's not like these, if you were to measure them, for most people, it's not like the cortisol levels are above the normal range. No, they're just a little bit higher than they would be if they didn't have all this stress, but they still tend to fall in the normal range. So it's like a way out of range. Okay. But this other thing is that cortisol also increases ghrelin levels. Ghrelin is that hormone. It's made along the intestinal tract, mainly in the stomach, but it increases ghrelin levels. Ghrelin makes us feel hungry. And if we have hunger, then we tend to eat more. Cortisol also tends to decrease leptin. Leptin's a hormone that's made by the fatty tissue, and it tends to be what I'll call a satisfied hormone, meaning that when we eat and we kind of get full, or as we fill up, leptin is released, and subsequently then we are satisfied. So for those people that tend to, I never get full, they typically don't have enough leptin, or they're leptin resistant. Okay, originally thought that he discovered leptin, and leptin makes you feel satisfied. It's like, hey, if we gave overweight people, if we gave them leptin, if we could inject them with leptin or give them leptin somehow, then they would feel more satisfied. Unfortunately, it doesn't really work that way, because what they find is just like you have insulin resistance, they probably also have leptin resistance, and so they tend not to really have the same control that other people that weren't leptin resistant. It's just that this diagnosis isn't so easy to make. All right, but leptin again makes us feel satisfied. If we're resistant to it, you don't feel satisfied, you eat more. Ghrelin levels, if they're really high, we get hungrier and we tend to eat more. Cortisol makes both of those things happen. All right, well, how about some just normal life changes? Okay, what I mean by that is as we age from childhood into adolescence to adulthood, things change. We all know that. Okay? But so people go through puberty, but also for women, they may go, pregnancies, as well as eventually all women go through menopause. And all of these life changes tend to produce shifts in hormones. Okay. And yeah, it makes sense. Okay. So there's shifts in the female hormones, estrogen and progesterone, and subsequently then these tend to cause weight gain. And as young girls go through puberty into adulthood, is that a lot of these levels then go up significantly as they mature. And these hormones do affect weight. So as girls mature into women and subsequently then estrogen levels, progesterone levels go up, they tend to, quote, fill out and they look kind of like an adult. Okay, in adult, the hips will widen, breast development, but also there's more fatty deposition. And these are all normal things to occur. Okay, now from a young woman's perspective, okay, estradiol, and humans make 3 types of estrogen. Estradiol is the most important one, and it is the primary estrogen produced by the ovaries. Okay. Now, estradiol actually tends to be somewhat weight neutral, except in really high levels. Okay. And just realize that at certain levels, during a cycle, during a normal monthly cycle, the estradiol levels can fluctuate tremendously. Some days it may be 400 or 500, other days down in the teens, and that's a normal thing to occur. And that's why you have cycles. But also estradiol, even though it's weight neutral in most normal levels, at really high levels, estradiol can make you gain weight and store abdominal fat. In low levels, it actually helps prevent abdominal fat storage. All right, so these are normal things that occur during a young woman's lifetime. But as women age then, all women eventually are going to go through menopause. Menopause basically means that, gee, the ovaries quit working. They don't work anymore. And so these levels, hormone levels, go really low. Okay. But as women approach menopause, they can get some changes occurring earlier. But menopause basically is the ovaries quit working. The average age of menopause is about 51. Okay, but it can happen 10 years earlier, 10 years later. So it's rare that those things happen 10 years apart, but still there's an average of about age 51 where women go through menopause. Okay, so during menopause, then the estradiol levels go really low. And since kind of normal levels of estradiol tend to make it a little harder to store fat, when estradiol levels go really low, it actually makes it a little easier to gain abdominal fat. And there's another thing that occurs during this time that actually magnifies this problem of fat storage, and that's estrone. I mentioned just a few minutes ago that there are 3 types of human estrogens, and we all make a little bit of each of them. Typically, this estrone is fairly low levels, okay, and that's throughout your lifetime. But as we age, and especially as women age, as the estradiol levels come down, the estrone levels actually go up. And estrone it's a hormone that's mainly produced not just by the ovaries, but also by the adrenal glands and also fatty tissue. And this estrone basically makes it easier to store fat. And anything that makes it easier to store fat subsequently then makes it easier to gain weight, okay, harder to lose weight. Also, one more thing with that is that testosterone levels also fall. This happens in male and females as we age. But as women approach menopause, and often starting sometimes in their late 20s, their testosterone levels decrease as well. And I know I've said this before, I'll say it again. Testosterone is an extremely important hormone for women. Women need testosterone, just not nearly as much as men do. Men need about 10 times the amount that women do, but women need testosterone. And just to put this into perspective, if I could measure the total amount of estrogen that a woman made throughout her lifetime and compared it to the total amount of testosterone she made throughout her lifetime, you actually make more testosterone than estrogen. And this is true for all women. Okay. The point of that statement is that testosterone is an incredibly important hormone for all women. And testosterone actually helps preserve lean body mass, keeps metabolism really high. It basically then, as your testosterone levels lower, and this is true for both women and for men, as testosterone levels lower as we age, it makes it harder to keep weight off. It makes it easier to store fat. And so, yes, testosterone, people will sometimes come to me for hormone replacement and they say, I want to get testosterone because it is going to help me lose weight, which is a true statement, except typically with testosterone replacement, it may take a year, year and a half before you start losing weight due to the testosterone. It takes a while for that to actually work. So sometimes women will come in and say, hey, I want to make sure I'm using testosterone because it's going to help me lose weight. Well, yes, it will in the long run. It's a slow weight loss, but don't expect it to be happen immediately. It's like, no, this is a long-term thing. But anyway, my point being there is that, gee, the hormones that protect you from weight gain, as you go through menopause, you tend to lose those. And you tend to gain hormones that tend to make it harder to lose weight. And so, yes, weight loss after menopause or during menopause is actually easier. So it's not in your head, it's not in your mind, you're not making it up. It's like, no, it does become harder to lose weight, easier to gain weight as we age. And that's true, especially with women going through menopause, but it's true for all humans. All right, another medical problem, very common, depression. Depression almost invariably leads to weight gain. Part of that is because often when people become depressed, they tend to eat more to kind of ease some of the emotional stress that's there. And emotional stress is all around us all the time. But with depression, it tends to become even worse. And so eating can then be a source of kind of, quick reward. That initial just feel good because I ate something tastes really good. But also it tends to be a cycle, kind of a recurring cycle. So it's a source of comfort, but also frustration because the eating to you, that initial little feel good, but then it makes it obviously harder to lose weight, easier to gain weight too. So it tends to be then a vicious cycle that tends to go along. And part of contributing this, part of the one thing that contributes to this is that a lot of the treatment for depression, antidepressants, actually tend to lead to weight gain. Most of them all lead to weight gain. There's Wellbutrin actually tends to actually help with weight loss, but that's about the only one. Most of them all tend to have side effects of, people tend to gain weight easier on these antidepressants, and therefore, I'm depressed, I'm gaining weight, now I gain more weight. When I take an antidepressant, that actually makes you more depressed. So potentially this can worsen that. All right, hypothyroidism. Okay, another really common medical problem that tends to lead to weight gain. And hypothyroidism is the opposite of hyperthyroidism. Hyper means your thyroid gland works too well. Hypo means it doesn't work well enough. So it's underactive. An underactive thyroid leads to hypothyroidism. Hypothyroidism can potentially lead to very rapid weight gain. Fairly common as women age. It's much more common in women than it is in men. Okay, it may not be fair, but it's the way it is. Okay, so much higher incidence in women, and actually, as women age, about 1 in 5 women, and actually probably closer to 1 in 3 women, will get hypothyroidism. And so it is important to follow up their primary care physician, make sure you're getting screened intermittently, because as we age, it tends to be more and more common. Okay. The screening test is typically obtaining a TSH lab value, which most primary care physicians do routinely, typically once a year. If you're actually on thyroid hormone, they may check it a little more frequently. So the screening test is TSH, which is thyroid stimulating hormone. It's actually a fairly poor screening test, but okay, it's one of the better ones out there. I guess it's what we have, without truly getting the full thyroid panel to see if you need it. So the screening test, typically TSH, is just not the best screening test in the world. All right, polycystic ovarian syndrome, another really common medical problem in women, because we're talking about ovaries. Okay, so this is a woman's problem. Okay, polycystic ovaries basically means there's little cysts on the ovaries themselves, and this is one of the most common causes of infertility, as well as menstrual irregularities in women. Okay, so it's really, really common. And typically, the individuals that have this are going to have these little ovarian cysts on the ovaries. And what that tends to do, they tend to run high levels of insulin, as well as a little higher level in testosterone. Okay? So often kind of women will think that, gee, the polycystic ovarian syndrome, that's really bad, my testosterone levels are a little high. Well, the testosterone itself potentially can help you, although side effects of testosterone are kind of acne. So women that have polycystic ovarian syndrome tend to have a little more acne. They also tend to have a little bit more kind of androgenic hair, meaning that they may get a little bit of that mustache, little extra wild hairs, little hair along the midline, very common. So they tend to have a little more hair growth, and that's secondary to testosterone level, as well as high insulin levels. The high insulin levels typically that's what causes the weight gain. And so, yeah, the insulin levels, they're insulin resistant. Okay. The treatment for someone with polycystic ovarian syndrome is really one of the best treatments is a very low carb diet. So either a ketogenic diet, really low carb diet. These tend to help lower that insulin levels. You can lower the insulin levels, typically health improves significantly, and as well as makes it easier for them to lose weight too. All right, sleep apnea, another really, really common medical problem. And I guess most sleep disorders, there's a lot of basically anything that makes poor or leads to poor sleep tends to make it easier to gain weight. There's a really strong correlation between poor sleep and weight gain. Some of that is just the sleep apnea itself. But if there are other reasons for poor sleep, whether it be stress, restless leg syndrome, there are a number of different ones that can lead to poor sleep, is that poor sleep tends to lead to higher cortisol levels. As we mentioned earlier, cortisol levels, when they go up, they lead to increased insulin levels, but also increased ghrelin levels. Ghrelin, again, is that hormone that makes you feel hungry. So insulin turns on fat storage, ghrelin makes you feel hungry. Therefore, you're eating more, you're storing more fat. So sleep apnea tends to be also a big culprit as well. It's kind of a two-edged sword there. Is sleep apnea basically makes it a lot easier to gain weight. You need to treat the sleep apnea to help lose weight, and weight loss tends to be a wonderful treatment for sleep apnea. So the other thing is kind of that you'll have lower leptin levels and growth hormone levels too. So sleep apnea is going to affect your growth hormone. And the reason is if you don't get into the good quality sleep cycle, growth hormone tends to be released really, really early in the morning, like in the 3, 4, 5 a.m. ranges. And it's a pulsatile thing. So it's really hard to not have a whole webinar on growth hormone, which I encourage you if you're interested in that or discussion about that, go to that. But growth hormone it's made by your pituitary gland in your brain, but it's released in a cyclic fashion. And so it's usually, or a pulsatile fashion is a better way to say it. It's not really cyclic. It's a pulsatile fashion. It's released in a large amount at certain times. And it usually is during your deepest sleep. okay, which is usually at 3 a.m., 4 a.m., 5 a.m., depending on what you are. So growth hormone is affected with poor sleep. And if we have growth hormone tends to protect you from lots of medical problems, but specifically also from weight gain. Growth hormone tends to help keep our metabolism higher, helps us build lean body mass, keep lean body mass. And so kind of these, when their growth hormone levels are low, makes it a lot harder to do this. So sleep apnea tends to work on the wrong direction as far as weight goes for multiple levels, meaning increase insulin levels, increase ghrelin levels, lower leptin levels, which we talked about earlier, as well as lower growth hormone levels. All these things tend to make it harder to lose weight, makes health deterioration easier. All right, so now lots of things, a lot of medical problems tend to lead or make it harder to lose weight. But there's also a lot of medications that tend to make it harder to lose weight. So many medications, one of their common side effects is weight gain. Some of the common culprits, there tend to be really common medications too. Hormones, often will do this. Contraceptives, some hormone replacement therapy, if you're getting too high levels of specifically of estrogen, fertility medications. Progesterone is one of the biggest weight gain hormones out there. Okay? So a lot of hormones that are used for fertility or as well as kind of for birth control, they often actually work against weight loss. Make it harder to lose weight, easier to gain weight. But other common culprits, steroids, okay? Steroids, which are often given and they could be injectable, they could be oral steroids for inflammatory conditions, from asthma to allergy relief to bone and joint pain. Okay, steroids are given for lots of different reasons, as well as then some other anti-inflammatory medications or anti-inflammatory immunosuppressants, where they're suppressing the immune system. Anything that typically suppresses the immune system makes it easier to gain weight. Okay? Almost every diabetic medication, insulin, the biggest culprit. So if you're on injectable insulin, okay, that's weight gain right there. Now, if you truly don't make any insulin, then you need the injectable insulin. And typically you're in small enough doses that hopefully you're not gaining weight like crazy. But especially most of the oral diabetic medications tend to be weight gain medications. There are lots of them out there. The glipizides, probably the one. Metformin typically doesn't have so much weight gain to it. I mean, doesn't actually work real well, but still, okay. But the newer medications don't gain weight. Actually, they help with weight loss. So the injectable weight loss medications, which just for, we talk about those more frequently nowadays. You hear about on social media and in the news and that type of thing. Actually, I'm going to do another webinar probably next week. We'll do this with Losing Weight USA. We're going to talk about some updates of kind of some of the injectable medications there. But the injectable diabetic medications typically, outside of insulin, okay, actually can work really well for weight loss. Those are the GLP-1, these what are called incretin hormones. I get in more detail next week. Okay, but they do tend to help with weight loss there. Okay. As I mentioned earlier, kind of most of the psychiatric medications, I mentioned the antidepressants, but literally any psych medication, almost all of them have side effects of weight gain. So whether you're taking from manic depressive or psychosis or whatever, most medications for psychiatric problems, as well as the antidepressants, as well as kind of the sleep medications. Almost all the sleep medications are going to cause significant weight gain. And people are almost never told that when they're started on, gee, I need they go to the primary care, I need some for sleep, I can't sleep, here's medication. almost all the medications, and that's including Benadryl, which is a very common over-the-counter. It's in a lot of the sleep meds that are over-the-counter, but pretty much all the sleep meds tend to have weight gain as a side effect of them. So I encourage people to try not to use so much of the sleep medications, as well as then many of the blood pressure medications, really common, from beta blockers to some of the diuretics. There's almost all the blood pressure medications typically have a side effect of weight gain with them. And so it's very, very common. And again, to encourage people, if you can talk to your primary care physician and see if you can get off some of these medications or use other ones, and it may not be quite so dramatic then. Because a lot of these medications are working against you. That doesn't mean you should just stop your medication. It's like, no, you're on it for a reason. Talk with your primary care physician about, gee, can we switch these or do smaller dose, whatever. All right, so lots of things that influence weight, very common medical problems, common medications, and they work against us. And unfortunately, getting those medical problems under control is also very important to keep health under control. All right, so a few tips for success. I encourage people, work on lowering your insulin. Insulin is truly the master hormone at controlling weight. And kind of high insulin levels, you're gaining weight. Low insulin levels, you're easier to lose weight. So if we can lower your insulin levels, and the best way to do that, and I talked about, there are really 6 ways of doing that, but low carb diet is one of the best ways. But also meal timing, and that just means there needs to be sufficient not eating times, which then includes, intermittent fasting, that kind of thing. It's never been a good eating plan to eat a little bit all throughout the day. It just does not work well. That's because every time you eat something, insulin levels go up. So you need to have not eating times. So meal timing is also very important. I encourage people to keep late night snacks to a minimum. We need to have those not eating times so we can have lower insulin levels, easier to lose weight. Exercise also helps with lowering insulin levels, but it's also one of the best ways to keep all these hormones in balance. It's like exercise, the more active we are, it works better. It helps break up stress. It helps us sleep better. There's so many different things that exercise helps with. It's not just, hey, I'm being healthier, which you are, okay, but there's more to it than that. And then try to get good quality sleep. Get that 7 to 8 hours of sleep daily. And I guess the most important thing here is really you want to become more knowledgeable about your medical conditions so that you can actively participate in your care. And that's probably the biggest thing right there. All right, question. I don't see questions sitting out there, but if you have questions, obviously pick up the phone, text us, walk in the door, whatever. Again, next week, very likely going to do an update on some of these the injectable weight loss medications, kind of what's going on. Some of them are getting harder to get. Anyway, we'll go into that in more detail next time. All right, little reminder, stop by the Center for Weight Loss Success, get your body count done, log into the membership site. You should be receiving the weight loss tips as well as weekly recipes. Tune in each Tuesday, 12:15 for the next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good day, everyone. Take care.